Hi, everyone. It's Kelly from the Hub here today with Todd Capiteo from Tabor Community Services, who is our friend and tells us about all of the ways to save money. How are you there, Todd?
I'm doing well.
That's wonderful. So last week we talked about ways to save on your prescription drugs, and we had all those websites, and I'm sure that some of you went to them and you're like, I never knew this, and now my whichever medicine is so much cheaper. So as you are still in the afterglow of joy from saving so much money on that, Todd's going to share with us ways that our medical assistance programs that medical systems in our medical systems in our area offer. So this isn't like Medicaid or Medicare, those kinds of government programs. This is like something that WellSpan has, or LGH has, or UPMC has. So this are ways, and Todd's going to tell, I'll just spill the beans on this. These are hard to find. So we're going to attach the slides for this so that you can see. Todd has found all of these applications for these programs so that you don't have to do all this work, because if you had to do all the work, you would be all frustrated and send grouchy messages. So Todd, take it away. Teach us all the things that we need to know so that not only our hospital can be a little bit cheaper, but we can also make doctors' visits cheaper as well. So you're the expert.
I always like to preface these type of things with stories, usually ones that I've been through. And I know years and years ago, my wife was having our first child, and we went in the hospital, and she didn't hand her card, the medical card, in. I handed mine since she was kind of busy at the moment. And
having a baby, right? Those little things.
Yeah. And for months and months, almost a year afterwards, I had to fight with my insurance company that they weren't going to cover it because I'm not covered to have a baby. So, but she is, and her card is coded to do that, and my card wasn't. So I get frustrated just like everybody else with insurances. And I'm a pretty laid back guy, but I've gotten pretty upset with all kinds of different insurance things. I know they're there to help us in most cases, but it's very challenging. And just that's just a silly illustration of some of the things that I've had to go through. But there's 4 major medical systems within our area. There's Penn State Health, which is the Hershey Medical Center. There's Penn Medicine, which is LGH. There's UPMC Pinnacle, which is the Lidditz Hospital now, since the one in Lancaster closed. And then there's, of course, WellSpan right in your backyard there, Kelly, in the Effort area.
Yep.
And obviously, WellSpan covers much broader. These cover much broader areas than just here. But these medical systems, they're medical systems, not just a hospital, not just a location. When you're a doctor, you go see a doctor and they send you for tests like scans or x-rays or blood tests or anything else. They're sending you to a place that's under one of these systems, most likely. So when you get the medical assistance program for that given system, then it covers all the different places that might fall under that umbrella. So if you're getting a surgery and you have to do the tests and you've gotten the assistance approved under LGH, let's say, then you want to make sure that you're going to places that the tests are being done by LGH as well.
Right, because the same program is going to carry you all the way through the whole process.
Yes.
If you're not paying attention to that, then you're just going to have to pay all those bills because you didn't do it right. Okay.
And now let me preface that though. If you get approved for one of them at one of the systems and you bring that paperwork to another system, so you got it approved at LGH and you bring it to WellSpan, they're most likely going to approve it as well because most of the program guidelines are almost identical.
Okay. So if a weird thing happened and you're an LGH patient and you needed to get in for something and the first available was at a UPMC location, you could say, well, and you could show them that. Oh, well, that's also good to know too, that because sometimes the qualifications can be cattywampus all over the place. So it's good to know that these are all pretty similar. Good.
Yeah, they're all
That's
very
helpful.
similar. There's no guarantees on that, but
Of
I've
course.
done it. I was with the UPMC hospital for some knee surgery stuff that I did years ago, and then they moved the hospital to Lidditz, and I didn't want to drive to Lidditz, so I just went to LGH, and I had already been approved through UPMC. I brought it over there. It took like 2 days, and I was approved under LGH. So I could then do the next surgery that they were doing and the assistance. Now, these assistance programs are good usually for 1 year. Then you have to renew them.
Okay, that's good to
So
know.
it's not a huge thing for renewal, but they're going to ask the updated income to make sure you still qualify for the income guidelines. But what happens is these programs are going to ask for income, how many people in your household, might get some demographic information and stuff like that. But usually when I went in for a procedure or a test or anything else anywhere, usually someone says, do you want information about our assistance programs? And like in me, I'm going, no, I don't need it. I don't think I would qualify is in
Right,
my mind. And,
right,
and I'm like, I probably make too much income. You probably have to make almost nothing before they would qualify you.
right. I would assume that too.
What I found was you could make a fairly decent amount of money, at least in my mind, and still qualify for these programs. I talked to a group not too long ago about this same thing, and it was a whole business, a whole bunch of people, one organization, and I told them the guidelines. So I told them, okay, it's 80% of median income or whatever it was for that program. And I showed them, and more than half of the people in the room would have qualified. And almost none of them have ever applied for any type of medical assistance programs through their hospital or through their doctors. So that's a lot of money that was probably spent. Not that everyone has health issues, but there's enough people that do. And especially when you know you're going in, like you're going in for a knee replacement or hip or
Right,
something that you can, it's not an emergency thing where it just happened because you got in a car accident or something.
right.
And you can do it then too, because some of the programs can also be retroactive. So let's say you go, great, Todd, yeah, I just got surgery done 2 weeks ago, and I'm just getting all the bills now.
Right,
Or months from now, you're still going to receive bills.
right.
You can go to them and say, I'd like to apply. And they usually have a window, maybe 60 days, might be 120 days. I've seen up to 6-month windows that they'll go back. And if your income was such then, and it is now, then you would qualify during that. And you could get whatever it is, whether they cover it 100% or they cover it at 80% or 50%. Sometimes they have some tiers that you may qualify depending on your income. But I'd rather take half of a bill versus the whole bill. Or better yet, not pay any bill. That
Right.
would be
And
even better.
these aren't, and remember, I mean, this is, these are significant bills. These aren't $100 here, $100 there. You know, medical bills are always significant. So half would be glorious for a lot of people. So yeah. Hmm. Hmm.
So
That's wonderful.
on the slides that'll be accompanying, I put in the actual address that gets you directly to the page that has the assistance. I found it a little bit challenging on some of the websites to find the actual application. So please use those to be able to get to those. I have the one for Penn State Health, the one for LGH, the Penn Medicine, the one for UPMC Pinnacle, and then the one for WellSpan. I will say that all of the applications themselves, from the standpoint of applications, weren't too bad, but it will be that extra paperwork. I would equate it to like doing a mortgage or a home loan, where they seem to continue to ask you for paperwork.
Okay.
You don't be discouraged if they say, oh great, Todd, you handed us this, this, and this, but we still want this. And then a week later they might ask for one more thing. So it's
Okay.
just the nature of the process. And they're trying to confirm things. Like in my case, I had adult children. One was under 18, one was over 18. They're both living in the household still. Do they take their income? Do they don't? Are they dependents? Are they not dependent? So I needed to give them more information than some other folks may have if their kids were 5 and 6 years old.
Right. Okay.
And there's no question at that point. So those are the type of things that you need to look at. But when I went in for a procedure 2 years ago, that was the first time I applied for the assistance, and I ended up having to pay zero. I didn't pay anything. I didn't pay my copay. I didn't pay my deductible stuff. I didn't have to pay anything for the procedure that I got done because I qualified 100% under this. Now, I had a family household of 4 then. Now it's only 2 because my children are not dependents. So that changes. So I may not qualify for 100% anymore. It might be 50% or 70%, depending on the program guidelines.
Do these programs, like, how do these programs work with like your insurance? Is it that if your insurance covers, like, let's say your insurance covers this much, and the medical assistance program for the hospital, whatever, covers this much, they'll take, I'm assuming the hospital will take the one that covers more.
Well, they're always going to take the insurance money first.
Okay, so they'll take the insurance money. Okay.
This is the assistance is for the part that you would have been paying out of pocket.
Okay, that's good to know, because I don't want anybody to think that it would conflict.
No.
So they're going to take your insurance money first, and then whatever that difference is, then they'll tell you you only have to pay this much, or it'll all be covered, or however that works. Okay.
But you bring up a good point. There's also very specific programs, and they're pretty elaborate programs here in Lancaster County because of the plain folks that we have around, the Amish and the Mennonites.
Yep.
A lot of them don't carry insurances.
Right.
And so there are self-pay programs that are probably better here than most places in the United States.
Because we have so many of those people. Yeah.
Correct. So there are programs, again, assistance would work with that, but then there's also payment plans. And a lot of the payment plans, actually, I can't even tell you the last time I saw a payment plan from a hospital that actually charged interest. Most of them, the repayment plans don't charge any interest at all. Their goal isn't not to get more money out of you. Their goal is to get what's due them for the procedure that you got. So I would say if you call them and talk to them and do something. The only caveat to that one is some of these places like dentists that have third-party lenders, obviously they charge a fee for that type of service. That's not an assistance program. That's just a loan to get you the braces or whatever it is that you're looking to do.
Right.
So that's something completely different. And the other part is if you go to a third-party creditor, like it gets charged off because you didn't pay it, those places also could charge interest on top of what you owe.
Okay.
So it's always good to deal with the hospital directly or the medical system directly versus letting it go to a collection.
Right, because if it gets to that place, A, there's no sympathy, B, there's no working with them, and C, you're going to get charged more than what you would have gotten charged before, most of the time.
Yeah. Possible.
Okay. Oh, that's good to know.
One other thing that I bring up whenever I bring this up, and I'm not going to in the slides it does show one organization, but there's a few organizations throughout the county that have what they call durable medical equipment.
Yep.
So if you need a wheelchair, you need a cane, you need the little scooter because you got ankle surgery or whatever it was at that point, before you pay hundreds and hundreds of dollars for one of them, you want to reach out, go on Google, go to one of the hubs, like the Northern Lancaster hub and other hubs that are in the area throughout the county, because they may have connections to some of this equipment.
Yep.
That was a huge thing because, again, using personal examples, I had knee surgery 7 years ago. They gave me, I went in there in the one place they had the TENS unit, the little unit that basically shocking your nerves back into doing certain things.
Yep.
They said, well, we checked it with your insurance and it will cost you X amount of dollars per month to rent it. And I said, well, how much if I buy it? If I just buy it outright? Well, it was like 25, no, it was like 45 or $50 a month to rent it, this little tiny device. And I'm like, that seems a little much for me. And it was only $100 to buy it. So I bought it, and I used my HSA. So I didn't really have to spend any extra money on it. It came out of that account tax free.
Right.
So yeah, sometimes asking the questions. Now, I don't really want to buy a wheelchair if I know I'm only going to be it for 3
Right.
weeks. So those are the ones that if you know it's going to be temporary and you know your insurance is not going to cover it 100%, sometimes in certain insurances, they'll cover those things 100% depending on if you met your deductible or not,
Right.
and those type of things. So if they're not going to, then borrow it.
Yeah, and there are enough people with enough connections around that for those kinds of big expenses, we can make that happen.
Yeah.
Yeah.
I would say walkers, wheelchairs, crutches, those type of things.
Yeah.
They're a dime a dozen, and people have them sitting at their houses.
Yeah.
And so yeah, there's a lot of that
Right.
stuff
Some of
out
those
there.
big things like a hospital bed, that's a different
Yes,
category
yes,
of stuff.
yes,
Yeah.
yes, exactly.
And
And
usually hospital beds are more covered because that's a real specific need that
yeah,
you have.
there's a reason why they're recommending it or
Yeah.
requiring it, depending on the situation.
Right. Right.
Yeah, certain other things, like if you need a nebulizer or something, I think, yeah, you need to have yours. I don't want to be
Right.
using,
Yeah.
yeah, so yeah, so those type of things, you know where to draw that line at
Yeah.
that point. But a vaporizer that just sits in the room and puts the vapor out, yeah, I could borrow my neighbors. I wouldn't feel too bad about that.
Absolutely.
So those type of things, trying to save money that way. But my biggest point now, after you go through all the insurances, and you do end up getting bills for things, whether you got a reduced amount or not, the biggest part is to double check your bills. It drives me crazy. Like I said to you earlier, but I have medical bills here, um, for things within my family right now, and I pay zero of those bills until I have the documentation from the insurance company telling me this is what we're covering and this is not what we're going to cover. And you'll get those, and it says in big bold print, this is not a bill. But if you see something out of the ordinary on that, you call the insurance company, you review it with them, you call the doctor's office, you review it with them. And long story short is I pay zero bills when they come in until I get that confirmation.
Yep.
I've run into it too many times. The best example, both my sons got their wisdom teeth out like a month apart. And it was the exact same procedure, exact same costs. We had checked beforehand. And that's another thing people don't know is you can actually check beforehand how much a procedure costs. And you can actually almost shop it around. You
Yep.
can go to different places and say, oh, well, my knee surgery at this hospital costs $1,000 more than this hospital.
Right. And if a hospital or doctor won't tell you that, I have learned from experience, you might not want to go to that place to get yours done.
Yeah.
Because
Yeah,
people
almost all
know
of them
that
are
now.
pretty good. Yeah,
Yeah.
they're usually pretty good about
Yeah.
it. So those type of things you wanna do, but don't pay the bill when it comes in right away just because you got a bill. I don't care if it's $9. You'd wait until you get the actual things from the insurance company, or if you have a website and you can go and check what they're actually. It's the explanation of benefits.
Yep.
You want to find out what they're covering and what they're not covering and why. Once I have that, then I say, okay, this bill is valid, at least in the eyes of the insurance company, and I at least know that the doctor sent it to
Right.
the insurance. I've run into it where if it was a doctor's office that we don't go to often, they had an old insurance card or they had this and that, and it never even got sent to my insurance.
Right.
So you have to double check these things and make sure that everything is correct. And
I
don't be
will
afraid
say,
to question it.
we have a family, we had a family situation where my stepdad was in the hospital and mom got the bill and she just opened it up and she saw the amount. She almost passed out. And then she was like, all right, I'll just start paying on it. Like, I can't pay the whole thing right now, but I'll just start paying on it. And I happened to be there and I said, can I just like look at the bill? I'm just curious to see what, da, 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 da. And she gave it to me and I looked at it and I said, Mom, it says that Dad took a life flight trip. Like, that's in the helicopter. And it was like $30,000 for the helicopter ride. And I said, Mom, Dad didn't take a helicopter ride, did he? And she's like, no. And I said, we need to check and see what happened. So my mom's married name is unusual. There was a person at the hospital with the exact same name as my dad, an unusual last name, and the same first name, who did take a helicopter. They have similar birthdays, and you're right. They like halfway, 3/4 put pieces together, and it was a nightmare trying to separate the two real bills to make it so they were legit bills for both patients. And it was worth a couple of months of some phone calls, and so that we didn't have to pay a $30,000 life flight charge.
Yes, and the other part is, and you bring up a good point, that you have to be proactive with these.
Yeah.
You have to reach out to them and question anything you don't understand. Now, that one was pretty blatant. You know that he didn't just take a joyride in a helicopter while he was there,
Right.
in between surgery or something. I don't know.
Right.
But yeah, it's one of those type of things that you need to be looking at those. But yeah,
And
that's
even
just
medicines, like, and this is not about blame. There's a lot of medicines that people take and need and stuff, and there could have easily been a medicine given, put on somebody's bill that really belonged to somebody's bill. And those easy things, it's okay to make that phone call and say, my person, or I never received this medicine. This was
right,
never in my thing. Please recheck my doctor's orders.
right.
Because I mean, I'm not saying we all are experts about medicines and procedures, but some things will certainly ring a bell in your head and go, nope, that one doesn't even sound like it's close to what I'm supposed to take. And
Yeah,
remember, you can always ask for help. I
yep.
mean, in these kinds of situations, please don't feel that like, well, I didn't go to medical school. How am I supposed to know all this stuff? That's okay. There are always people that you can ask for help. You can call the hub. You can call any of those kinds of places, call the doctor. And if they're not willing to help you, trust me, there are plenty of places for you to be able to reach out to be able to get that kind of service. So yeah,
And
absolutely.
the whole thing is, if you have insurance, you need to know what your insurance covers and doesn't cover. And especially you need to know what your deductible is. Because without fail each year, I usually end up meeting my deductible. And then I get a bill after my deductible has been met. And then I call my insurance company and say, why are you not covering this? I already exceeded my deductible. Oh, no, you didn't. And then, oh, yes, you did. Okay. And so, yeah, and I track it. And I'd have to, especially where I work, because where I work, they have a program that I don't have to pay all of my deductible. As I pay it and I go over a certain dollar amount, I then have to submit the bills to my employer, and my employer will reimburse me back up above a certain level until I meet the deductible, and then the insurance covers all of it. But there's a gap. So let's say my deductible is 5,000. When I reach 2,500, then I need to start submitting them in to my employer, and they will reimburse me from 2,500 to 5,000. I'm just using that as an example. But
Right.
if you don't know your insurance policy plan and you do the whole 5,000, you just lost $2,500 if you don't submit those bills. So some of these the way the insurance is set up is not easy peasy that you know all the ins and outs, but you do need to understand it.
Right. And just because you may have had the same insurance at the same employer for multiple years doesn't mean that it's exactly the same from year to year because the insurance coverage may be the same, but the way it's applied may have changed over time. So it's certainly worth, I mean, truly, this is not exciting Thursday afternoon reading when you're looking at the stuff, but money's money, man. And that's the
Yeah.
whole point of these, is to say, ooh, I could save money if I just pay attention to this stuff.
Yeah.
Yeah.
That's at the end of the day, I want to be in good health and I want to be able to do everything I want to do, but everything being equal, I'd rather pay half or little to none for it if I can. And sometimes it just takes a few hours on a phone call or sending an email. But yeah, it's those type of things that it each person says my time is worth XYZ.
Right.
So if you don't feel your time is worth trying to look these things up, then don't worry about it.
Right.
Um,
If it's $20 and that's okay, you'd rather just spend the $20 and be done with it and not, fine. But if it's $20,000 or $2,000 or whatever, right? What is your amount that you're willing to make 5 phone calls for?
yeah, I would say on average, I've saved thousands of dollars a year by doing these things and the prescription stuff we talked about last week. Between those, yeah, I've saved thousands, probably tens of thousands of dollars because this stuff isn't cheap.
And for you, it's a habit. And I think that's one of the hardest things that we're going to talk about money for a while. So it's about the habit. Once you start, it becomes part of your thing. So you put it on the calendar, or you just know it. Every February, I have to re-up my whatever it is, my medical assistance program at LGH. So then you do that. Or you're used to making 2 or 3 phone calls. If you're not used to doing those things, you're going to find it sort of a pain in the butt when you first start. But when you get the benefit out of it, then you're like, oh, okay, that's totally fine. It's about changing a couple of things in your behavior to making it be worthwhile. Yeah.
And some of these things, they're open all 24 hours. So I've called at like 1 or 2 in the morning because I couldn't get a hold of them during the day. It's whatever, what to each their own. But I know that will save you time and money and peace of mind when you know you can go in and get a surgery that you know you need, like on your back or your knee or whatever, and you go walk into it knowing exactly what the costs are going to be, or better yet, no costs. That's peace of mind that you just need to worry about recuperating and getting better, and not, oh crap, I have all these other bills now
Right.
on top of all the other bills that I have to deal with all the time.
Right.
Yep. So
Good advice as always, Todd. Thank you very much. We will talk to you again next week about another way that everybody can save a little money. Fabulous. See you, everybody.